For over 150 years, cancer has been categorized by where it shows up in the body, yet for decades researchers have known that it's a genetic disease caused by issues within our DNA. Today doctors are learning that a melanoma growth might actually have more in common with a lung cancer or brain cancer than another type of melanoma. So the focus of precision medicine is really understanding what is causing the cancer as opposed to where it's showing up in the body. Our bodies are composed of over 30 trillion cells, and each of these contain a complete set of DNA instructions. But over time, certain instructions may become corrupted. And if the body can't repair these errors, then cells can begin replicating in an uncontrolled manner. And that's what we typically define as cancer. By comparing the DNA of a healthy cell to the DNA of a cancer cell, Watson Genomics identifies the DNA issues most likely driving the cancer. It then searches the relevant databases and literature to determine drugs that could be effective in treating the patient. And it's doing this analysis in minutes, where today it may take researchers days to even weeks to collect comparable information.
Let's see how Watson Genomic Analytics works. The first step is what we call the molecular profile analysis. Patients may have thousands of mutations, especially in later stages of cancer. So we need to look at this input file and searching the medical literature that includes millions of articles and curated databases, try to identify which ones are the relevant mutations that might be driving this cancer versus the mutations that are only passengers. So the top 100 mutations are then shown in a diagram for the doctors to take a look at that and have an overview of the tumor. The second step is to find potential drugs. Out of all the relevant mutations, some of them may have a direct target, but some of them may not. So we need to look at this biological pathway. It's kind of like a network of signals in our body, and see if there is a way to cut the signal. The last step is to bring all this information together in a report. So there is a summary that shows those actionable mutations with the drugs, and that the doctors can drill down and get more information about that. Information such as the drug label, clinical trials, statistics on clinical outcomes, and even looking at the specific articles that's supporting those evidences. The report has several categories. For instance, what's the drugs approved for the same cancer type that the patient has, approved for other cancers, or investigational. And with this summary, you can see if the drug has a target for that particular patient, or in some case, the drug may not have a target, so you avoid to give that drug to the patient. And that's how Watson Genomic Analytics is helping the doctors. All this information is bringing together and is presenting as options for them to decide what's the best approach for her or his patient.
It's a very exciting time. We've established a Watson Genomics collaboration program where we're currently working with over a dozen cancer centers that are assessing the system right now. And they're beginning to use the system side by side with their existing processes on current cancer patients. And they're considering the feedback as part of their patient treatment plan. In terms of the future, most of the leading oncologists and clinicians today believe that genomic medicine will play a large role in cancer care in the foreseeable future. And we believe that Watson Genomics will play a significant role in helping these institutes devise a more effective treatment regimen and in turn improve the quality of care for cancer patients throughout the world.